Starting this morning with the Niger Delta of Nigeria having not been doing in the fight against the spread of coronavirus. And looking at some of the states in Delta, Governor Ifeanyi Okowa was commended for swiftly establishing the food bank to cushion the hunger effect of the ongoing lockdown occasioned by the COVID-19 pandemic ravaging the world. In Edo State, the government built a 30-bed facility with 15 ventilators and other important equipment to treat these COVID-19 patients in the state.
On the part of Akwa Ibom State, it carried out sterilization of Victor Atta International Airport, Ibom Specialist Hospital Market, Ibom Plaza, and other strategic locations in the state. In Rivers State, the government earmarked $2 billion from its 2020 contingency funds to purchase foodstuff for distribution to Rivers people as palliatives against hardship imposed by COVID-19. The government also stated that the state will no longer allow expatriates a flight into the state.
And in Cross River State, despite not recording a case yet, the government is building capacity for COVID-19 response by recruiting 400 doctors, 600 nurses, and 1,000 health officers for COVID-19 surveillance across every village in the state. Well, joining us now to discuss this and more is Ankyo Briggs, environmental and human rights activist and advocate of improved social welfare for people of the Niger Delta region. And indeed, she will be discussing the state of the region amid the increasing COVID-19 pandemic in Nigeria. Thank you so much, Ankyo Briggs, for joining us this morning. Great to have you.
Thank you for having me.
Well,
thank you.
Going by the available statistics of the Niger Center for Disease Control, at least 4 states in the Niger Delta region have recorded cases of COVID-19. And you did hear in our introduction what the states are doing. The Presidential Task Force vows that there's a national response. There's one national response. But it seems as if every state is doing its own preparedness and response differently. But what's your take? How are the states in the Niger Delta responding to COVID-19 in your own opinion?
Okay, in my own opinion, the fact that every state is doing its own thing is just the right way that it should be done, because we are a federation. At least we're supposed to be a federation. Now, quickly going back to the Niger Delta region and taking what has happened, first, we see very clearly that by the grace of God and by people doing what they're supposed to do, and by the governors, I believe, also being effective, we have seen that very little of the numbers of infected people is quite low. So that's good. The fact that the governors are trying the issue of palliatives, as it is called now, it is actually social welfare, which it should be when other countries that have established quality and good long-standing social welfare structure are able to cope much better and actually deliver better than we can ever do in Nigeria, because we don't have those social welfare structures in place. So what the governors are doing are actually trying to set up a structure that should have taken decades to set up and perfect. They're trying to set it up in weeks and perfect it in weeks. We're not going to have that perfection, but whatever we learn from here, we're going to have to input it in and start the process of change that advocates have been asking for, which is change for a restructured Nigeria. If we had years ago, decades ago, practiced real federalism, we would have gotten a better response. Now, when people are hungry and people who were unemployed before this time remain unemployed, people who are homeless remain homeless, the problem is compounded when you say to people that they shouldn't go out. But whether we like it or not, as unfortunate and sad as this call to stay at home is, it is the only way right now, today, all over the world, of stopping and slowing down COVID-19 from spreading in the way that it has spread in the developed world, where they have quality hospitals, where they have breathing apparatus. I don't think that there is a state before COVID-19 came that actually has a working standard high quality breeding, any kind of breeding apparatus in any of our hospitals. So these are the problems that we are facing in the Niger Delta and will face in the future unless we do things that we are supposed to do and do them rightly.
Okay, thank you, Prince. Thank you so much for that. But suffice to say, some of the governors, like you say, are doing quite well. Governor Ifeanyi of Delta State did put in, some ventilators and set up an isolation center. But a lot of people are also challenging what the governors are doing. They're saying they're not doing well enough. In fact, somebody did call me all the way from Delta State the other day, and Emmanuel Winnie. He said, anybody that says a COA has done well, you should take a trip down to Delta and see what it's like with the palliative. I want to go to Rivers State. A lot of people have called me and said, Rufa, is this the time that Governor Wike should be having a fight with the government as regards airspace and landing of expatriates that work in the oil sector? So there are those factors on ground. What do you say about those factors? So as we're saying they're doing well, some people are negating those factors. They say they're not doing well at all.
Okay, all right. Now, first of all, I definitely, when I see people carrying polythene bags of 2 cups of rice, I ask myself, what is that? 2 cups of rice, 1 cup of beans that seems to be insect inflicted and rotten rice and things like that. I'm not saying that that is what is happening in any of the states. I can only speak for Rivers State as somebody who lives and works in Rivers State and as an indigene of Rivers State. But generally, the whatever is being given to people as palliative can never be enough. How can it be enough when we have not identified who needs this palliative? If you offer me a bag of rice now, I won't take it. Why? Because I don't need it. Why don't I need it? If I can afford a quarter bag of rice, I won't take it. Let them give it to somebody else who cannot afford it. So we need the structure in place. And our people, I have said it, as unfortunate as it is, this is where we find ourselves. We must learn what is happening now and then begin to put the structure down, even right now and going forward. Now, coming to Rivers State, the issue of what you call them, essential workers is all over the world. Now, the primary essential workers are healthcare workers, the people that function, the healthcare workers, transportation, up to a level, internal transportation, and to a large extent, the economy. Now, in the case of Nigeria, the economy is oil and gas, very, very simple and forward. Now, if you say that the federal government controls the airline, the airspace, which they do, and if you say that the government owns the oil in my region and in my state, which they do for now, and therefore you have even helicopter companies and their workers that they're ferrying up and down, the oil workers up and down, then that's fine. Now, those people, if you are bringing them into Rivers State, as in the case between my government and the federal government and the oil companies. Now, if you are bringing somebody into Rivers State, the governor is not saying you shouldn't bring them. At least that's my understanding. I've not spoken to him. I read what he says, and I support it, that they can come in. And I also support that when they come in, they must be tested. They must be tested for COVID-19 because they are going to Rivers State, whether they are going to their platform, whether they are going to their offices, I don't care. If they are coming into Rivers State, they are working in Rivers State. If they have COVID-19, they're going to spread it. If somebody has it in Rivers State, they're going to catch it. So they must be cleared of COVID-19, either before they come in or when they are in River State. It depends on what the federal government wants. Now, when people say, oh, the Constitution does not allow Wike to say so, the Constitution does not allow it. For me, those are discussions that are not of life and death. The COVID-19 is a discussion of life and death. This morning, I was watching the governor of Kano State, and the governor of Kano State was saying on television that he will do everything and that the law permits him to do everything and anything to keep the people of Kano safe from COVID-19. Now, if that happens in Kano State, why on earth should it not happen in River State? It is people who are making issues of the fact that Wike wants to protect the people of River State. It is the chief of staff, the late chief of staff, that went to Germany and was infected with it in Germany and brought it back to Nigeria. And so you cannot, anybody can get it and anybody can spread it. And I believe very sincerely that if we are truly honest with ourselves, we are seeing lessons every day that we must learn, and lessons that will move the states forward. It's very clear now that the states can cope on their own if they are able to use and utilize the resources that is in their land. And when it is not shared, people will say, okay, look at today now, the price of oil is not $2, it's minus $2. Very soon, oil companies are going to stop because they have no place to stockpile. The people that this disease originated from China, which is also the manufacturing country of the world, which is rather unfortunate, means that because they are no longer manufacturing, they don't need the oil. And so the purchase of oil, and because the countries are shut down, America, UK, everywhere is shut down, the need for oil and gas to a very large extent is slowed down. And that is why we have a situation today in Nigeria where the only two sources of revenue, oil and gas, nobody's buying it, nobody wants to take it off of you. So what is going on between in River State, between Wike's position on behalf of River State and River people is a position that must be supported.
Yeah.
Go ahead.
Okay, so, I mean, at the end of March, we did see NDDC come out to say that they were going to donate 1 billion naira to the funding to support COVID-19, and even an extra 270 million naira to make sure that there's a boost in the isolation centers, as well as a fast track of these isolation centers in 27 senatorial districts. Now, as of April, can you say that you are confident with how far these monies have been spent? Because there's a huge trust deficit in how this money is being spent, with people saying that a lot of it is not being met by the poor who desperately need these palliatives.
I am so sad and so disturbed that NDDC, that is in the eye of the storm. NDDC today is an agency for Niger Delta. It's not an agency for Nigeria. It's an agency for Niger Delta. It's an agency for the oil-producing states of Imo, Abia, and Ondo, and the other 6 states of the Niger Delta region. The NDDC has various question marks hanging over its head. The NDDC has contractors complaining from the Niger Delta region that they are not being paid, and that other people from other regions
are being paid. I'm going to have to interrupt you now. We will continue this conversation once we come back from the break. Join us again.
Welcome back. You're still watching the Morning Show here on the Rise News, and we have joining us back the Niger Delta activist, environmental activist, and social welfare activist, Ankyo Briggs. Thank you so much for joining us again. We know connection has been a bit poor, but thank you anyways. You were speaking about the NDDC funding for response to COVID-19 before we had that interruption. Shaitan had asked you how these funds are being utilized and if you're confident with it so far. I don't know if you want to respond again to that question before I then ask you my next question.
Okay, cool. Now, the thing we must not forget is the fact that the NDDC, the Ministry of Niger Delta, the Amnesty Program, these are all programs that have been set up for the Niger Delta region. Now, any funding out of this that goes outside of the Niger Delta, it is not acceptable. Now, if the NDDC is giving out so much money when it is under so much controversy, it is very worrisome, because it should not forget that it will have to account for this very specific money that it is spending now, whether it is spending it through the federal government or it is spending it through the governors or the people of the Niger Delta. This has to be made very, very clear, because this money is not for any other thing but within the Niger Delta region. Therefore, if it is spending this money, it must go directly to the beneficiaries of the NDDC and not to federal government. It doesn't make sense that government gives this money to NDDC, and then NDDC now, in times of crisis, whatever the crisis is, will not give it back to federal government. No, it should give it to state government, to the people who are actually on ground and able to utilize this money for the Niger Delta people. So I am very concerned that the NDDC have chosen at this time, when we're talking about auditing NDDC, that they have taken this amount of money when they are owing people to now put into COVID-19. They must account for this money after COVID-19.
Indeed. Well, Andrew Briggs, as an environmentalist in the Niger Delta region, you would be aware that it is no news that the health of the local people in the Niger Delta region has been impaired as a result of oil and gas exploration. We do see cases of respiratory diseases in the region. And talking about concerns, I wonder if there are any serious concerns that should COVID-19 take a foothold in the Niger Delta region. At the moment, we have at least four states. Are there any concerns that this would be a total disaster, considering the health consequences that we are already seeing in the Niger Delta region?
Absolutely and totally. Don't forget, my sister, that before COVID-19 ever reared its head, or Ebola, SARS, all those things, for as long as we have had environmental pollution, this issue of respiratory problems have been creeping in slowly within the Niger Delta, to the extent that we know that people are suffering from unidentified diseases, cancers, especially asthma and heart attacks and stuff like that. So yes, when it comes, Niger Delta actually should be considered a region that has underlying issues, if you see what I mean, because already we have the underlying issues of respiratory diseases and problems, health issues, that the Niger Delta people are undergoing, breathing problems to do with exploration of oil and gas. Now, when you bear in mind that the real issue with COVID-19 is a pneumonia type of reaction, disease that has no cure, it is only by the grace of God that we will not get COVID-19 to the extent in the Niger Delta where it will get out of hand if it actually creeps into the Niger Delta. And so it's horrifying when I see federal government dishing out money, 20,000, 40,000, 60,000 to only people in the northern part of Nigeria. If this does not show you how unfair and unjust this present government is, and how it doesn't care about the people who actually produce the wealth that they are sharing the way that they are sharing today. And that's why people like me are able to say that we don't need whatever it is that they are offering. Let us get around the table. After COVID-19, the governors, the people of the Niger Delta must see by now that we are very obviously, absolutely, and totally on our own. And therefore, we must move this agitation forward. For at the very minimum, we must have self-determination. If we're not able to get that, and it's clear that the federal government is not able to do anything, is not willing to do anything.
I'd like to come in here real quickly. Two questions as we start to wrap things up. Number one, how is the cleanup going? Because the cleanup too was to clean up the environment in the Niger Delta, and the environment too impacts the health of the people, one way or the other. How is the cleanup going in the Niger Delta region? Secondly, I'll quickly like to talk about the economy of the fishermen in the Niger Delta that has been terribly destroyed. On top of that, you now have COVID, that is an economy destroyer on its own. How are these people going to cope?
Now, when you ask about the cleanup, again and again, I have said it, and many people are confirming it now, within the entry point, that is within the point that the UNEP report came in, to say that there has been no cleanup. There cannot be any cleanup when the people who are supposed to be cleaning up have no clue what they are doing. If you're going to clean up the devastation of what has happened in the Niger Delta, you have to bring people in that have done it somewhere else in similar conditions. That's one. Two, the issue of fishermen and the type of farming we do in the Niger Delta region, knowing fully well that I grew up in the creeks in the 50s, knowing the type of fishing we do and farming that we do, that have been destroyed systematically since the exploration of oil and gas have started, to the point that our people no longer have a livelihood. On top of that, we have strangers who have invaded our communities to fish in our communities. Now, these are also things that we must discuss in the future. Now, when we come to COVID, the issue of COVID-19, the people that are going to suffer, the poverty level will increase, the job losses will increase. It is still the Niger Delta people that are going to bear the brunt of COVID-19, God forbid. And economically, that is, we're praying that it wouldn't explode in the Niger Delta, because it's only prayer that will help us here, because our people are not even understanding the need for social distances. I understand the hunger, but as I said 2 weeks ago on my radio program, it's only somebody who is alive that is going to be hungry. And so we need to find a way within our states to cater for our people. And so if the people are saying the palliatives are not enough, the governors need to go back and look at how these palliatives is being shared. And so, but at the end of the day, the reality is that we, the Niger Delta people, the people in the Niger Delta, do not have the type of medical intervention that is being used abroad. Even Ghana is doing much better. The type of medical intervention that is needed to keep people alive and to bring people alive out of COVID-19 crisis, we don't have it in the Niger Delta. We don't even have it in Nigeria. But I'm talking about the Niger Delta. And so it is worrisome. And the people, unfortunately for us, the people must play a major role. This issue of distancing is so important, because anybody can carry it, anybody can share it. So it is very important. Once we are able to enhance, we should work a structure how our people are going to be able to survive.
I totally agree with you.
Within this time of social distances, and change our lifestyles. We have to.
Indeed. Well said. Thank you so much, Ankia Briggs, for coming on the show today. We really do appreciate you, environmental activist from the Niger Delta region.